Yeah. So what we are trying to do now is try to look at the lung, right? So this is how the normal lung looks under ultrasound. So what I'm using over here is a linear probe, 12 frequency probe, and you can place it anywhere on the chest and try to get an image like this. So the essential parts of the image, what you see over here, this is a rib over here, and there's a rib over there, and what you see below that is a acoustic shadow. It looks like a bat wing on both the sides, right? In between, what is more important for you to see is to locate the lung sliding. Dr. Kong, can you show me the lung sliding on the image? You can see this is basically a visceral on the parietal pleura. They are moving, sliding against each other. That basically shows the lung is normally expanded and it's moving with every breath. The visceral pleura and is basically moving over the parietal pleura, which is the normal sign that the lung is fully expanded and it's functioning normally. Okay. So now after this, what I'm going to get is I've checked it out. I will try to use the M mode. For the M mode, I have to use a different. So with the vascular probe, this is not going to work. I want the M mode. Okay. So for M mode, I need to use a different software. So change the probe. This is a cardiac probe, right? 5-1. Change the probe to 5-1. You can use that as a deco. You can adjust accordingly, right? You place it over here. You don't see the eye scanner. Yeah. It's not the best way of doing it, but let me see if I can do it. Let's come to the other side. Not so good as the linear probe, right? The depth is too high. Okay. The jelly is basically going down there. Yeah. Good. So in a normal lung ultrasound, you're basically looking for two things. First is the lung sliding that I've shown you before. So let's go over there once again, just to revise. So you have a linear probe, which is in this case the depth was how much is it? Probably 4 centimeter. The depth. Now so down 3 to 4 centimeters, and you have used a 12 frequency probe. And you have what you see over here. You have the two ribs in the acoustic shadow, which is basically the bat wing pattern. And in between, you can see the normal lung sliding, the visceral pleura moving over the parietal pleura. Now, what we are trying to do is we're going to use the small footprint probe, which is either a 5 or an 8 frequency probe, and you're trying to look at M mode of a normal lung. Using M mode, you can see certain signs which basically tells you whether the lung is normal versus abnormal. Now, before using the M mode, you have to look at what a normal, to know what a normal lung looks like. So, a normal lung, air is enemy of ultrasound.
Yes.
Right. So, a normal lung does not actually have a very typical feature. Basically, you don't see anything. It's a normal lung. So it's like, I call it, it's like back on my television, which without any connection. What you see is that there's a sort of haze and maze, just like this grainy picture. And what you see additionally, you see vertical lines over here. Slightly, not so much, but some vertical lines, which are basically, artifacts, ultrasound artifacts, which basically characterizes the normal lung. Now, on top, if you go close to it, reduce the depth, and again, you can see the lung slide. Can you see that now? That's it. That's basically a normal lung slide. All you have done is you reduce the depth from maybe around 8 or 10 centimeters to come down to 4 centimeters. And to look at the pleura very close. Now, once you're very close, and the frequency is, see over here, it's 132 hertz. you need a high frequency to understand how or to see with good clarity the movement of the fluid. Now, once you get this, you put the M mode on the lamp, right? Right? We acquire this image. So now let me explain. What you see over here, this black portion is the skin, subcutaneous tissue, the muscles, intercostal muscles, and the ribs and everything. And this white line is the interface between the muscles and the skin and the structures of the chest cavity. And this is the pleura, and this is the normal lung, right? And if you look very closely, if I can zoom this, no, this won't be getting a zoom, but if you look at it, there's very thin vertical lines over here, right? And so it's a texture which is both having vertical lines and also horizontal lines. This is what you have to remember in your mind. This is the M mode of a normal lamp, right? Maybe this is the sand in a seashore, right? This is the sand, and this is the interface where the ocean begins.
Oh yes,
Right. Now, if you have a pneumothorax, so what happens? Suppose we call a lung point. Lung point is that point we have a small anterior pneumothorax. So suppose you have a lung point over here. What will happen is you have a pneumothorax on this side, and this is normal. So this will see something like this picture over here. And in this part where you have the lung point and the pneumothorax, this part will become, the entire thing will become like this. Like this thing will come over here. So this lung portion will be replaced by this, like the image of what you see over here on top. So then the point where you see the difference between a normal lung and that of a pneumothorax, it's called a lung point. Okay? Got it?
Yes.